So overall, vaccines are good. Vaccines
Oh
should
yeah.
be offered to people because we eliminated many diseases globally. Polio, look at that. We have eliminated measles in many countries, mumps, and many of those, the kids are being successful, happier, healthier living. We have the longer, the biggest lifespan trajectory we had it until COVID hit. Then many countries start to go downward trend, including USA. I do believe we should not discard our good science. We should always learn from science and keep asking the question the way you asked question today.
Yeah. How can we do better? So for me personally, my doctor's like, you don't need it. It's too much. It's more risk than reward. And where I live, we didn't have in Tennessee, we don't have mandates. So it was fine. Like other than flying with a mask, I really didn't, COVID didn't happen in Tennessee. Like we took that year off. We were like, we're just going to do our thing. School stayed in session. Like, and our rates, again, it's, when you saw the initial videos of people falling over in the street, like whatever, however true those videos were coming out of China, I don't know. But yeah, I completely agree. All my children have all their childhood vaccines. None of them got the COVID shot. I'm to this point, I don't know if we have the gene. So they're good. Everything's good. We ended up making the right decision for us. But again, it's an individual. Like you said, it's an individual situation. And the jury's still out on, all I know is that right now, I mean, we're in a better place. I'll just say that. And we
Yes.
live and learn. And the last time we had a pandemic like this was, at least in the North Americas, correct me if I'm wrong, was the early 1900s with the flu, right?
Yes.
That was the,
Yeah.
and,
Yeah.
and a very similar trajectory, right? They were wearing masks back then. There was public panic, but the one thing they didn't have that we do is Twitter and Facebook. So you take that initial implosion of complete just, oh my goodness, just going out of your mind. And then you amplify it with social media. We were the Spanish flu on steroids, not Spanish flu, but yeah, it was Spanish flu on steroids.
Yeah.
So it was fascinating. So going into, I really appreciate you answering that. It helped me a lot and helped me learn a lot as well. So going into actually actionable things, what are the top 3 lifestyle changes people can make to significantly reduce their risk of heart disease?
Make sure you get up. Your sofa is a coffin. So you make sure that you get up more frequent from your sofa. And as often you can do it in a day, it'll help you stay longer, healthiest, less chance of obesity, less chance of heart disease, hypertension, cancers. Number 2, throw away all your microplastic containers or the food that is you're cooking in, and trying to pick up again glass or steel, trying to go back to the roots. So cut down as much as microplastic you can. Third thing you should do is throw away all your hyper processed, highly palatable food. Go back to the basics, your parents. So start cooking your own food. Know your food, where it comes from. And when you're putting in your mouth, you should know where it comes from, what does it have. Not just because you're hungry and you're watching a TV or watching a game and you start eating just without looking at it. Look at it. If you understand the ingredients, and they make sense, at least 80% of it to you, eat it. If they don't make sense to you, don't eat it.
Yeah, I mean, this is refreshing. So let's go deeper into diet. So obviously you live with a dietitian, so she's gonna be yelling at you about diet stuff all day, like I yell at my wife about studies on hypertrophy, right? Like my wife is so tired of hearing about me talk about muscle growth and programming. She probably hates me. I'm surprised she's still here. So delving into diet, if you were to design, like you have the Mediterranean diet, low carb diet, plant-based diet, if you were to say, okay, this is these, and it doesn't have to be any one of these, this is the style of diet that I would recommend to you for the optimal heart health, realizing that most people aren't going to follow any specific diet 100%. Here's what I would recommend you eat for your best heart health.
I would say Mediterranean. And there's one fascinating study happened just published last week. And in the study, what they looked at is people who are using butter versus more olive oil or plant-based oils. And when they replace that from simple butter to these plant-based oils, they have less chance of having heart disease and heart attacks. They end up living longer just with one thing getting it out from in that study
Wow.
cohort population. So if you're going to follow a lifestyle, follow a Mediterranean lifestyle. What is it? It has a whole grain, whole food, olive oils, and plant-based oils coming more in your diet than anything else. And personally, I try to follow that too. So we do have fresh fruits and vegetable in my diet every day. At least I try to make sure five types of fresh fruits and vegetable come in my diet every day. I make sure I don't drink juice. I eat fruit. That's very important, and because I get a fiber
Same.
with that, it lowers my
Yes.
cholesterol. It lowers my inflammation. It lowers the chance of constipation, less chance of getting colon cancer. So this with the more fiber I'm taking, the longer I was going to live, the less chance of me taking medications. And I make sure that I hydrate myself well. Lots of people don't even drink enough water. So it's important to drink 2 to 3 liters of water for your body, for hydrate yourself. And From a meat perspective, if you're going to pick up a meat, pick up a white meat. Chicken breast probably is a
Okay.
better choice than the red meat. See, we understand the red meat may not be as helpful from a heart disease perspective. Some patients, saw the data in some research that it was causing inflammation. It may not be the population level, maybe in that small cohort patient population there. You're going to pick up meat, pick up more white meat. If you're going to pick up a fish, pick up salmon. More colorful fishes are better than the white fishes. So the choices are there, and that's what our lifestyle has been become. I'll tell you one funny story. A long time ago, when I came first to Canada, from Russia, and my wife is Russian, and there at home she was drinking skim milk, fresh fruits and vegetables, and she had a lifestyle made. And I'm coming from Russia. I'm a guy who likes certain kind of foods. So I start to follow what my wife was feeding me. Eventually, you want to have a fight at home, so you start to eat slowly by slowly. So one time I was going to a medical conference and driving, and I stopped on the way at McDonald's. I said, I'm going to have a burger. It's been months since I had a burger. And I'm going to drive and enjoy it. At least I'm once upon a time, I can have fun. So I took it. I started driving, going towards conference to Banff, mountainous area near Calgary. So by the half away, I started to feel my stomach being upset. So I wasn't happy. So I called her. I said, I'm angry with you. She said, why? I said, because you messed up my stomach. So now the food I used to enjoy, so I cannot enjoy anymore.
Yeah. So, I always pack my food. If you're not prepared, if you fail to prepare, you prepare to fail. And I always pack my food. I always feel great when I travel. I know where to eat, where to get those good foods that don't have the nasty things in them. So that's diet, Mediterranean diet. I've been saying that's the healthiest diet for years. People call me stupid. They say low carb's the healthiest now. I feel low carb has some applications,
Yes.
tremendous applications for certain things. But I think for the generally healthy person who's not battling with maybe diabetes,
Yep.
maybe other things, that could be an application. Seizures, another application. But for most people, Mediterranean diet, I made the simple switch of instead of putting butter on my toast in the morning, I drizzle olive oil in it, put a little sea salt on
Perfect.
top. Simple changes like that go a long way. So, exercise and its impact on heart health. Is there a specific type of exercise you'd like to see for heart health?
From a heart health, now we used to say you do cardio, cardio, cardio. Not anymore. So what the data we have seen, what I would recommend people is that do 15 minutes of cardio and 15 minutes of muscle. You have to have a muscle reserve.